is Dr. Patel. I recently started working at RMC in November of 2021. As part of my background, I've been doing robotic and minimally invasive surgery since I started training in OBGYN. So I did 4 years of residency in OBGYN, which included training on the robot, traditional laparoscopy as well, and I did another fellowship in Texas for 2 years in advanced minimally invasive GYN surgery. So I did more robot surgery there, traditional laparoscopy, and also natural orifice surgery, which is scarless surgery. So I've done hundreds of cases in minimally invasive surgery in my career so far. Primarily, I like to use a robot for most of my cases. It adds to great visualization in the operating room and great dexterity. So any case I can ultimately do on the robot without having to do an open procedure. For certain candidates, I'll do natural orifice surgery, which for us it would be from the vaginal natural orifice. It's called V-node surgery, so we can do tubules that are scarless and hysterectomies, and adnexal surgery, which is also scarless, which is great. Alternatives to minimally invasive would be doing a traditional laparotomy or an open procedure. That would consist of having either a vertical midline incision, or a lot of times when we operate in the pelvis, we will do a fan and steel skin incision, which is basically a C-section scar. And the recovery time for those is typically longer, about 6 weeks or so, whereas minimally invasive surgery could be as low as 2 weeks, or even some patients do much better in a matter of a week or so. And another difference is patients have to stay in-house or in the hospital after doing a laparotomy or open procedure, usually for about 2 nights or so. But if we can do a minimally invasive surgery, they can go home the same day. Absolutely, patients do have a choice as to what kind of surgery they would like to have performed. Sometimes there are some outliers where perhaps an open procedure is definitely required, but as long as there's adequate training by the surgeon and experience, and the patient is not one of those outliers, then they can have a choice in minimally invasive surgery. One thing for certain types of surgery, like natural orifice surgery, there are some patients who are not good candidates for it. They might include patients with endometriosis, prior pelvic surgery, or lots of scar tissue. However, robotic surgery, I think most people are pretty much a good candidate for robotic surgery or any traditional laparoscopy. A lot of times I ask patients, if it's something that's not related to cancer, for example, if it's something related to pelvic pain, I always ask my patients, what's your quality of life? If you're on your cycle or around that time of the month, are you unable to get out of bed, unable to go to school or work? Is this affecting your life? Does it take 5 days out of your entire month, which is a long time? That's 60 days in a whole year that you're not really, able to enjoy your life and do normal things. Then you may want to ask yourself, is surgery right for me? But if you're somebody that maybe medication can control your symptoms better, maybe you might want to wait for surgery. So it's really tailored to each individual patient. In my GYN practice, I see a wide variety of age ranges, from younger women who may need surgery for pelvic pain, endometriosis, infertility, having fibroids and heavy bleeding, to even older patients who may have a postmenopausal adnexal mass or postmenopausal bleeding and may need surgery for that, or even pelvic organ prolapse, urinary incontinence, any of those things. And we can do most of those surgeries and fix most of those problems using minimally invasive approaches. We have a dynamic robotic committee and program here at RMC. RMC has recruited a lot of younger physicians who have trained on the robot from the start of their career in medicine, And basically, all these cases can be done close to home. You don't have to travel back and forth for your visits. You don't have to drive back and forth for pre-op or post-op visits, or even for surgery itself. Since at RMC, we have built a dynamic program here to offer the same care you can get elsewhere, if not better, in my opinion. So you can essentially get the right care right here at RMC.